Great. Well, thank you everybody for taking time out of your day, and it's lunchtime in many places across Nebraska. So thanks for logging on in the busyness of the moment and in your day. I really appreciate you as an interested Nebraskan and your collaboration as we continue to plan for 988 and just for being a champion in suicide prevention and saving lives. I also want to thank our DHHS partners in communications for helping us with the logistics of this webinar. For members of the deaf and hard of hearing community and individuals with other disabilities, we are recording this meeting and we'll post it on the 988 website with captions available. And that website is dhhs.ne.gov/988. The recording should be on the website yet this afternoon. And if you have questions or comments after watching the recording, please contact Michelle Nunemaker, and I will introduce her shortly. Michelle can be reached at Michelle, MICHELLE, .Nunemaker, NUNEMAKER, at Nebraska, spelled out NEBRASKA.gov, G-O-V. So I really think it's important that we all remember that the 988 can certainly help us save lives and really positively influence a crisis moment for Nebraskans. And I want to share with you an email that I received from a parent. As a parent, I never want to have to ask for help. As a parent, I do not want my children to struggle with depression, drug addiction, and suicidal ideation. But when these struggles became a reality in our home, the Suicide Lifeline saved my son's life. Through calling the Lifeline, he was able to connect with someone who listened without judgment, was empathic, and was able to provide immediate referrals to life-saving resources. The Lifeline provided the help and the healing resources that we as a family needed to support my son as he begins his journey of recovery. And they signed it Jack. So again, before I introduce Michelle, I just want to tell you how grateful I am for all of you as partners who provide behavioral health and 24/7 crisis call and other crisis services every day to individuals that need you. I really want to thank our regional behavioral health authorities, all of our system providers, healthcare providers, the 911 and public service answering point partners, law enforcement, and so many behavioral health system partners that really have continued to help us collaborate in this initiative. We want to continue to listen to you as stakeholders and problem solve how Nebraska can have the best system over the next few years. And so we are going to continue our 988 work groups and 988 advisory committee, and all that information will continue to be on our 988 website. We're really, really fortunate in Nebraska to have such dedicated partners. So I'm going to introduce to you Michelle Nunemaker, who has been our 988 planner lead really over the last several months. And we have had an implementation core team that has just been fabulous as well. And again, Michelle is just going to provide an overview for you, and then we will take questions. So Michelle.
Thank you so much, Sheri, for that. Jeff, if you want to go ahead and put the presentation up on the screen. Okay, so our Nebraska 988 messaging for messengers. I'm going to go through this PowerPoint here with you today. This presentation can be found on our 988 website in our marketing toolkit. We've created this presentation to provide you all with some messaging that we would like to see be consistent, as well as just make sure that you have the information that you need as you go out to share and spread the message about 988 and saving lives here in Nebraska. Next slide. So the 1-800-273-TALK, it transitioned on Saturday over to 988. Going along with our Nebraska Needs You, Help, Hope, and Healing in the Heartland, our campaign around suicide prevention, we wanted to stay consistent with that messaging. Next slide. So here's some of the background information about where 988 came from. 988 does build upon the existing National Suicide Prevention Lifeline, which has been in operation since 2005. Next slide, please. And I think we would all agree that too many people are experiencing suicidal, mental health, or substance use related crises without support and the care that they need. And unfortunately, the pandemic has only made this situation worsen in America. Um, as you can see here on the slide, nationally in 2020, there was approximately 1 death by suicide every 11 minutes. From April 2020 to 2021, over 100,000 people died from drug overdoses. Um, More specifically here in Nebraska, unfortunately, suicide is the second leading cause of death for ages 10 to 34, fifth leading cause for ages 35 to 44, and then overall, it's the 10th leading cause of death in Nebraska. Next slide. There is hope, and our lifeline works. The Suicide Prevention Lifeline in Nebraska, you can see we've so far, just from January to May, there were a total of 4,903 calls. As you can see, those numbers of calls are increasing every month. It's great to see that people are reaching out and asking for help. Studies have shown that after speaking with a trained crisis counselor, most callers are significantly more likely to feel less depressed, less suicidal, less overwhelmed, and more hopeful. Next slide. So our soft launch of 988, it took place over the weekend. We had a great launch. Things went smoothly. So as we build our 988 system, we recognize that it is going to take some time for us to get to our full vision of a transformed crisis care system. It will require continued collaboration, commitment, and support to make it effective, appropriate, and sustainable, both from the public and the private sectors. In the short term, we are looking to strengthen and expand the current Lifeline Crisis Center infrastructure and capacity to ensure that trained crisis counselors are available to quickly respond to 988 via call, text, or chat. Boys Town National Hotline is the location of our 988 provider. They are continuing to hire as needed, but they are doing a great job of ensuring that folks are available to take those calls and answer those texts and chats. In the longer term, our vision is to build a robust crisis care system across our nation, or excuse me, across our state that links callers to community-based providers, and so that they can receive crisis care services in their own community, and hopefully to keep people in their homes and less access or less burden on our emergency department systems or our law enforcement or EMS systems. Next slide. So the desired change for 988 is a three-pronged approach, and I tend to think of it as a three-legged stool. All three elements of 988 are needed in order to sustain a stable foundation for addressing mental health and substance use crises. The first leg is someone to call, the second is someone to respond, and the third is somewhere to go or community support. Next slide. So someone to call, the 1-800-273-TALK moved to 988 on July 16th. It is staffed 24/7. We have trained crisis counselors there who will take those calls, and they will provide some de-escalation, try and safety plan with the individual, find out what's happening with them, and then triage the situation. They can provide referrals and resources for same day or next day appointments or other community services. And then they are also able to activate mobile crisis response to go to the individual when appropriate. Next slide. Wanted to give you an idea of what that caller's experience is. 988 is not exactly like 911. When you call 988, calls will be routed first through Vibrant Health System, and it does not go directly to a person. So as you can see in the red arrows, as you call, the caller will hear prompts. Those prompts include press 1 to connect with Veterans Crisis Line, press 2 to connect with the Spanish subnetwork, or to remain on the line and be connected to a local crisis center. So that is when they would be connected to Boys Town here in Nebraska. Next slide. Someone to respond. So across our state, we're continuing to expand our youth and adult mobile crisis teams. The goal is to meet the consumer where they are at. That could be in their home, that could be at school, that could be out in the park, that could be in their place of business, wherever it is that the individual is needing to be contacted. We do have some co-responder models in our state, which are licensed individuals who will respond with law enforcement. We're focusing on adding people with lived experience to our teams. We have standardized trainings and expectations, provide post-crisis follow-up, and also provide referrals for services. Next slide. So our vision of somewhere to go and those community supports, we will continue to develop crisis receiving and stabilization services across the state, working on bed registry and availability for referrals, working on same day and next day assessment, outpatient medication and management. We have been fortunate to have our providers identify some same day or next day appointments that they do have available. So our mobile crisis teams will have that information, as will the call center. Looking at developing mental health and substance use crisis respite for youth and adults, as well as a peer-run hospital diversion or a peer-run crisis respite type of center. Next slide. So we need you to help us spread the word. If you visit our DHHS 988 webpage located at dhhs.ne.gov /988, you will find our marketing toolkit, which contains numerous marketing materials that you are welcome to print and share. You'll find public service announcements in English and Spanish, 988 frequently asked question sheets in English and Spanish. You find this message for Messenger slide deck, a number of flyers and posters, as well as other social media graphics that you can share to help us spread the word about 988 in Nebraska. Next slide. So I just wanted to say thank you. This is a very brief but high level presentation, but these are the basics about 988 and sharing that information in our state. And so now we will go ahead and open up for questions.
Jeff, I imagine that people, I can't see the chat, but I know people are used to putting questions and comments in the chat, so please continue to do so.
So we have one question from Chrissy Walsh. Is there only an option to call, or can someone text 988?
So yes, you can text 988. We're also on the Lifeline page, and I can find that address and put that here in the chat for everyone. There's an option where you can chat right through the web page.
All right, well, that is the only question. Oh, let's see here. They're starting to come in. And this is from Jill Kazulka, and I apologize if I pronounced that wrong. And Jill, I'd be happy to unmute you if you'd like. But her original question is, how long will the 800 number still be active, or will that number go away?
That number will remain active. We're not really sure exactly how long, envisioning probably, what do you think, Sheri, about a year?
That's what SAMHSA and Vibrant I've heard so far, that they want to make sure everything transitions smoothly for about a year. Mhm.
So folks will still be able to call that 1-800-273-TALK number if that's the number that they are used to calling, and we'll still be connected with the crisis counselors here in Nebraska.
And Michelle, I would just add too that we have awesome 24/7 crisis lines throughout the state, as well as our mobile crisis response teams. And so we made a decision early on in our planning that we were also going to keep those available, so that if someone in Nebraska was already familiar with those local numbers, that they could continue access. So we'll continue to work with our teams and look at the calls and so forth. But again, access was really important as we did the launch.
Great. And Jill responded with a thank you. And so a question from Colleen Easter Wyman, and I'm sure I messed that up as well. Other than SAMHSA, where can we get 988 wallet cards? And that might be a communications question, and we can look into that, get that on the website for people interested.
Yes, so we are working on outside of SAMHSA, working on here in Nebraska how to get access to those wallet cards. So we will be working on that. Please keep an eye on our 988 marketing toolbox. We will continue to add marketing materials as those are developed.
Okay. So we have another question from Denise Bulling. What are your suggestions for those who may want to modify your PowerPoint?
So, Michelle, I'll just jump in and say, one of the opportunities we wanted to take in Nebraska was to do this PowerPoint that champions such as yourself that are listening today would have the opportunity to share. And so that we have consistent messaging across Nebraska. If you or your organization wanted to maybe add or change some things, would love for you to just loop back with Michelle and run things by. We just want to make sure, that the message would be consistent, things continually change, and that, you'd have the most current information. But hopefully some of the existing PowerPoint will continue for that consistent message, and then maybe you can personalize it on your end, but work with Michelle on that.
I do want to add that I am also working with someone to help take this PowerPoint and translate it into Spanish. And she is also willing to help us get that presentation recorded in Spanish. So that will be coming as well.
Great. We received another question from Liz Chamberlain. If someone commits suicide, can a family member call 988 just to talk to someone?
So I would say individuals that die by suicide, try to use the that language for individuals. Yes, 988 is active and available to help family or friends or community members, loved ones. And then also in Nebraska, we do have the local outreach for suicide survivors or loss teams throughout the state. And those individuals are amazing at really understanding and helping individuals and families as well.
Okay, well, I believe that is all the questions for now. If anyone has anything else to add, please post it now. Otherwise, I think you guys did a good job and answered all the questions.
Or feel free to unmute yourself and ask a question as well.
If you want to put something in chat, I actually have to unmute them.
Oh, my bad. Sorry about that, Jeff.
No problem.
We really want to, again, thank you for your time and interest and sharing the news with the 1-800-273-TALK transition to 988. So many partners across Nebraska have just been amazing, and we hope that you'll continue to help us with those messages. And just please stay tuned to the 988 webpage. We will keep the toolkit that Michelle talked about, most information, our stakeholder meetings and webinars, and just all things 988.
Thank you all so much for attending today and helping us to spread that message. I hope you all have a great rest of your day.